Okay, we're going to cover chapter 20 now, drugs for Parkinson's disease and Alzheimer's disease. You want to know the key points, and we're going to cover that. Just remember, utilize all your resources. Parkinson's disease is a chronic progressive neurological disorder that affects the extra pyramidal motor tract, which controls posture, balance, and locomotion. The symptoms of Parkinson's are failed, basically shuffling gait, arm swagging, knees and hips that are flexed, and just the shaking are the telltale signs. Parkinson's disease is the most common form of the Parkinsonism, which is considered a syndrome or a combination of similar symptoms. Now, Alzheimer's disease is a chronic progressive neurodegenerative condition with marked cognitive dysfunction. Various theories exist to the Alzheimer's disease, but neurotic plaques degeneration and the cholinergic neurons and deficiency is in acetylcholine among them. Um, Now, exercise can improve the morbidity, balanced diet, and fiber, fluids, prevent the constipation, and support groups for coping. There's many different theories. They say vitamin E in high doses helps. The main thing is the definitive diagnosis is actually cannot be for certain until an autopsy is performed. There are different types of Parkinson's, um, and the pseudoparkinsonism is the frequently occurs as a adverse reaction to chlorpromazine, um, halo, basic halidol, lithium, metochlopramide, and methodopa, um, and the risperidone. Now, that could be secondary to the tardive dyskinesia. In addition, Parkinson's symptoms could result from poisons or disorders such as arteriosclerosis, encephalitis, infections of stroke, trauma, or, quote, Wilson's disease. You know, you want to make sure you know that with a genetic disorder in which copper builds up in the body, and signs and symptoms are vomiting, weakness, ascites, a swelling of the legs, yellowish skin, itching, tremors, muscle stiffness, trouble speaking, and changes in the personality and anxiety. Now, symptoms of Parkinsonism can be lessened through the use of non-pharmacological measures such as patient teaching, exercise, nutrition, and a good group of support. Parkinson's disease is caused by an imbalance of the neurotransmitters dopamine and acetylcholine, and is marked as a degeneration of the neurons of the extra pyramidal motor, basically motor tract, in the substantia nigra of the midbrain. Dopamine is an inhibitory neurotransmitter, and the acetylcholine is the excitatory neurotransmitter. In Parkinson's disease, an unexplained degeneration of the dopamine neurons occurs in imbalances between DA and ACH results. With less DA, production of the excitability response of the acetylcholine exceeds the inhibitory response of DA, resulting in the symptomatic movements of disorders of Parkinson's disease. By the time the symptoms of Parkinson's appear, 80% of the striatal dopamine has already been depleted. So, refer to that table on 20-1. Drugs used to treat Parkinson's disease replace the dopamine deficit and reduce the symptoms. Now, the treatment for Parkinson's has come a long way. These drugs fall into 5 categories. 1, the anticholinergics. 2 is dopamine replacements. 3, dopamine agonists. And then 4, the MOAOB inhibitors. And then the 5, the COMT inhibitors. The anticholinergic drugs reduce the rigidity and some of the tremors characteristic in the Parkinson's disease, but have minimal effect on the bradykinesia. And then anticholinergics are parasympathetics that inhibit the release of acetylcholine. Now, the first dopamine drug actually was levodopa. The enzyme DOPA decarbonylase converts levodopa to dopamine in the brain. So it is found in the peripheral nervous system and allows 99% of the levodopa to be converted into dopamine before it reaches the brain. Because of the side effects of levodopa and the fact that there's so much levodopa is metabolized, because levodopa is no longer available in the U.S. Now, that it was caused the nausea, vomiting, it caused orthostatic hypertension, cardiac dysrhythmias, and psychosis. Now, because of the fact the levodopa and the fact that it metabolized before reaching the brain, an alternative drug, carbidopa, was developed to inhibit the enzyme DOPA decarboxylase. By inhibiting the enzyme in the peripheral nervous system, more levodopa actually reaches the brain. Now, when the carbidopa is combined with levodopa in a ratio of 1 part to 10 parts levodopa, the enzyme decarbonylase is inhibited. Now, the advantages of the combining the levodopa with the carbidopa are more dopamine, where it causes more dopamine to reach the basal ganglia, and that smaller doses of the levodopa are required to achieve the desired effect. So remember that. That's important. It's also important that the disadvantage of the carbidopa-levodopa combination is that more available levodopa and more side effects such as nausea and vomiting, the dystonic movement, and psychotic behavior. It actually, but it is less of the peripheral side effects. So You want to suggest the patient to take it on an empty stomach because this will decrease the absorption of the carbidopa, levodopa. So you just want to make sure um, the the dopamine receptors from the medication into the central nervous system and it goes into the cardiovascular and GI tract. Patients who do not tolerate carbidopa, levodopa are frequently given um, bromocriptine because it also works on the dopamine receptors in the nervous system. Enzyme monomide, which is oxidase, which is MAO. It's not the same MAO inhibitor as we talked about, but it causes the catabolism of dopamine. The selegiline inhibits the MAO-B, thus prolonging action of the levodopa. It decreases the on-off fluctuations. Large doses of selegiline may inhibit MAO-A, an enzyme that promotes the metabolism of the thyramine in the GI tract. If they are not metabolized by the MAO-A, ingestion of foods, you always want to have foods high in thyramine, aged foods, dairy, meat, poultry, fish, homemade yeast bread, soy, red wine, aged fruits. We'll want to make sure that the ingestion of those foods can cause hypertension. So you want to avoid the foods I mentioned because they'll actually increase that same amount of the thyramine. Now the enzyme catechol methyltransferase, which is COMT, interactivates dopamine. When taken with levodopa preparation, COMT inhibitors increase the amount of levodopa concentration in the brain. The tolacapone was the first COMT inhibitor taken with levodopa for advanced Parkinson's disease. This drug can affect liver cell function, therefore serum level enzymes should closely be monitored. Always make a baseline and then monitor it thereafter. So the common side effects of the anticholinergics include dry mouth, dry secretions, urinary retention, constipation, blurred vision, and increased heart rate. Mental effects such as restlessness, confusion may occur in an older adult. Dyskinesia, impaired voluntary movement, may also occur, which is with the high levodopa dosages. And you can hear that also, you hear of tardive dyskinesia. Now the amantadine has few side effects, but can intensify when the drug is combined with other anti-Parkinson drugs. Now, if bromocriptine is taken with carbidopa, levodopa, a combination drug there, usually the drug dosage are reduced and the side effects of the drug tolerances decrease. Pramipexole and ripinol intensify the dyskinesia and hallucinations caused by levodopa. With the catapone, the urine can be brownish orange discoloration. With tolcapone, the urine can have dark discoloration. Both can intensify the adverse reaction of the levodopa. Alzheimer's disease is an incurable dementia illness characterized by chronic, progressive, neurodegenerative conditions with marked cognitive dysfunctions. Now, usually you'll see it, the usual onset is from 45 to 65 years old. The etiology of Alzheimer's is still unknown, although the factors through the influence of other Alzheimer's disease are genetic predisposition, virus infection or inflammation that attacks the brain cells, as well as the nutritional, environmental, and immunological factors. And now the symptoms of Alzheimer's disease include memory loss, confusion, inability to communicate, aggressive behavior, depression, and psychosis. The cure of Alzheimer's disease is unknown. Drugs that treat Alzheimer's disease symptoms include acetylcholine inhibitors. These are tacrine, donepezil. Just look at the drugs that they have for treatment of the Alzheimer's and go over those and know those. These ACE inhibitors or ACE inhibitors increase the cognitive function for patients with mild and moderate Alzheimer's disease. A reversal inhibitor used to treat mild, moderate disease is galactamine. Okay, you have 3 stages in Alzheimer's. First, you start out with the memory lapses, difficulty concentrating. Sometimes some of us think during nursing school we're becoming habit because of the fact there's just stress. But if you know you already have issues, there's not an issue with Alzheimer's, because people with Alzheimer's aren't aware they're having problems. And you have issues with organizing, planning, may still be able to drive, work, and socialize. And then you have the moderate. It's the longest stage. It lasts many years. It's irritable, moody, withdrawn, display frustration, anger, personality and behavior changes of sleeping pattern, may forget what day it is, and other simple recall tasks, may wander, unable to perform routine tasks, and then you have issues with loss of bowel and bladder control. Now the advanced, which is the severe, you have short-term memory. You forget just the recent experiences. The previous known individuals require supervision constantly and assistance with all the ADLs, unable to respond to their environment or engage in the conversation, unable to walk, sit, or swallow. For the most part, there are no drugs which can cure Alzheimer's, but some will help slow the progress. Now, remember, considering a care plan for a client with advanced or severe, and always focus on appropriate self-care. Okay? So that is the conclusion of this wonderful chapter. And It's hopefully in the future, near future, there's a lot of advances going on with these two diseases. So hopefully they will progress in our lifetime to where we can not have to experience this with our family. So y'all have a good day. If you need to ask me anything, just email me. Thank you very much.